We have some encouraging news today. It's an experimental new hip replacement surgery that could revolutionize medical care for the elderly. CBS 2 Health Watch reporter Dr. Mike Rosen has more.
I skied 2 years ago. I didn't ski last year.
Bear in mind, lying in a hospital bed is unusual for Arthur Scantlebury. He's 69, but he's a young 69. For a guy who's been active his whole life, a degenerative hip was a source of frustration and pain.
I bicycle, I work out, I've been running until I had this hip problem. I couldn't even walk for a while.
And that's when Arthur decided to get a hip transplant to get him out of pain and active again. But because Arthur is so young, he's expected to live a long time. And that makes him a poor candidate for a hip transplant, because the artificial hip wears out after a decade or so.
You're 40 years old and nobody wants to operate on you because your hip's going to wear out in 10 or 15 years. You can't have a hip replacement.
And so what happens?
They're on disability, they're handicapped with a cane or crutches.
The problem with the standard prosthesis is that this plastic over time disintegrates, and in turn, it causes the thigh bone to disintegrate. Not so with the ceramic prosthesis.
This is the future of orthopedics and hip replacement surgery.
This is what Arthur got, a finely ground and polished ceramic hip that has a lifetime guarantee. It's thought. It's in the final phase of FDA testing.
It's smooth, it has just as much motion.
But it is ceramic. Isn't it susceptible to breaking?
Sure. But these ceramics now can tolerate, I think the number is more than 17,000 pounds of force.
For the 15% or so of hip replacement patients under the age of 50, it will no doubt mean a lot. And for young 69-year-olds like Arthur. Yes, that was Arthur in a triathlon.
Considering that I want to be active for a lot more than 15 years, I wanted to do it to get on with my life so that I can live my life the way I want to live it.
I'm Dr. Mike Rosen, CBS 2 News.
Yeah, could help a lot of people.
Go get him, Arthur.